My name is Brandy. I'm a nurse at Memorial Hospital, and I'm also a student at BYU Idaho Online for my bachelor's degree. And I'm going to be doing a little presentation on the guide
One
to
in the back room
healthy
is dead.
heart. So, about 80% of older adults have at least one chronic illness, and 50% have two. So, a chronic illness is cancer, diabetes, or cardiovascular disease. And cardiovascular disease consists of coronary artery problems, which can cause heart attack, atherosclerosis, which is basically plaque buildup around the vessels, and high blood pressure and high cholesterol, which also can lead to the atherosclerosis and lead to further cardiac problems. Today I'm going to focus on cardiac disease, not necessarily cancer. So the best ways to prevent a chronic condition is to do appropriate screening. So frequent doctor's visits, blood pressure checks, routine blood work, and smoking cessation. Untreated high blood pressure can lead to heart attack, stroke, or other heart problems. Factors contributing to blood pressure include salt intake, heart damage, kidney function, and genetics. So if you have a previous heart problem or previous kidney problem, then that can result in higher blood pressure or make your blood pressure not as maintained. Blood pressure oftentimes doesn't cause any adverse effects until it's in its advanced stage. So controlling your blood pressure is the most important factor in taking care of yourself. Ways to control your blood pressure include eating a healthy diet, so lean meats, vegetables, fruits, not a lot of fatty foods or sugary foods, drinking lots of water unless you have a condition that tells you you probably shouldn't drink as much water, like heart failure. Regular exercise, typically they say about 30 minutes a day. Limit the amount of sodium you eat, reduce stress, and take your medications as prescribed. And like I had said before, blood pressure doesn't cause any adverse effects until the disease is very advanced, so you want to take care of it early. It's kind of one of those things that you don't see now, you see it later, but you need to take care of it for the time being. So I don't know if you can see this very well, but this is a healthy vessel. It's open. This one is a tighter vessel. Typically, this means that this person has high blood pressure, whether it's atherosclerosis that's built up on the outside walls, whether it's stress that's constricting the vessel, or sometimes medications we give can constrict those. If you have a low blood pressure, they can give medications for that. So whenever it's smaller, it's kind of like a hose. You got a lot more pressure. Whenever there's a lot more pressure, things can break. If there's like a leaky, loose area, not as strong, it can break loose. It can cause an hemorrhagic stroke or hemorrhagic anywhere else. Basically, a vessel is weak in one area, and high blood pressure can make that rupture and have you bleed out somewhere. So this is the plaque that builds up around your arteries. This is a normal vessel. It's kind of just similar picture, but it shows like, looks like fat tissue is what that is. So things that cause atherosclerosis, which is the plaque buildup around your vessels, are uncontrolled diabetes, uncontrolled blood pressure, bad cholesterol. There's good cholesterol and there's bad cholesterol. So the bad cholesterol is the one that causes the atherosclerosis. Smoking, obesity, stress, poor diet, not exercising, and excessive alcohol intake. So atherosclerosis can cause coronary artery disease, which is chest pain, heart attack, and I'll show a picture here soon that shows what causes this chest pain and heart attack, which is the plaque buildup around the vessels on top of your heart. The cerebrovascular disease, which includes ischemic stroke and mini stroke, and peripheral artery disease. So basically this is plaque buildup in your brain, on your heart, and then in the vessels in your legs. So those vessels aren't just as big, so they tend to get more built up. So here, this is a hemorrhagic stroke. This is where the vessels are weak in an area, like I talked about, and your blood pressure is really high. So if it's weak in this area, it's going to break eventually. It's going to rupture, and you're going to have a bleed here, and then that's going to cause deficits in your brain. That's from uncontrolled blood pressure, typically. Sometimes it can be genetic if you have just small vessels or weak vessels. In a ischemic stroke here, you can kind of see, I don't know if you can see it from there, there's the atherosclerosis built up here on the edges, and then whether you have a clotting problem, blood can get stuck here over time, or it can be because of a clotting disorder.